Good evening, ladies and gentlemen, and welcome to the Nobody Asked Me Guys show. I'm your host, Melvin Casey Lars. And guys, you know how we rock and roll on this show. We always have dynamic guests along with dynamic topics. Now, tonight we'll be discussing with at least three of our parents, maybe more, about sickle cell anemia. Now, many of us do not have the working knowledge of sickle cell anemia. We've heard about it, we've talked about it. Some of us may have family members that are having challenges with sickle cell, but we don't often get a firsthand account of sickle cell anemia. And our moms that'll be with us tonight, along with their beautiful babies, will be sharing with us many of their triumphs and trials. And we will also discuss many things, what kind of legislation they may like to see passed, what kind of support, both medical and personal, they like individuals to share, etc. So, audience, you know how we do. You guys are welcome to grab a camera and come on with us. However, you are also welcome to use the chat room, and then I will share those questions to our parents tonight. But first up, we have with us, and they'll be with us throughout the entirety, is my first mom that's already here with us, and we move on time, is Ms. Lenreya Vincent Burke. Ms. Burke, good evening.
Hi, good evening. How are you?
Listen, I'm fantastic, and is so happy. We're so happy that you are here on the Nobody Asked Me Guy show. And we first want to thank Dr. Asha Pillai for being so concerned and so caring. And she was sharing with me the names of some of the parents and individuals that she was working with. And so I'm just really pleased that you're here with us tonight and that you were willing to share with us. Now, they didn't come to hear me, so I won't waste your time with a lot of unnecessary babble. If you will, please, if you would share again with our audience your name, the name of your baby, and how this whole process began.
Okay. Hi, everyone. My name is Lenreya Vincent, and this is Grace Vincent. She has been diagnosed with sickle cell anemia since birth. How it came to be is I have sickle cell trait and her dad has sickle cell trait. So the two of us come together, produce two kids with sickle cell anemia. Grace is 8 and we have a 3-year-old who also has sickle cell anemia. Grace has been, her sickle cell started the crisis. She goes through crisis, and that is a period of severe pain within the limbs. With sickle cell, the blood is shaped like a crescent moon, so they can get trapped in the joints. That causes pain. A normal person's blood is the shape of a circle, so it moves through the blood vessels with ease. But that of a sickle, you have regular cells as well as sickle cells, and they can get trapped in traveling throughout the body and joints, and it causes severe pain. When she was 3 months old, we had her first crisis of where her joints and her fingers and her toes were swollen. We went to the hospital, and I remember distinctively that they could not find a vein because she was such a chubby little baby. And the doctor said to me, like, oh no, we're gonna have to shave her head off, her hair, and put the IV in her head. And I completely spazzed out and panicked because I'm like, you're not shaving my baby's hair. You need to find someone in this hospital that can find a vein. And they called an anesthesiologist, and they came and was able to put a vein in to give her some pain medicine. We got introduced to All Children's hematologist in Tampa, Florida after that for treatment. And then a few months later, we decided to move to South Florida, and we got in touch with Joe DiMaggio's Children's Hematology. And at 9 months, she started taking hydroxyurea, which at the time was not prescribed for babies because she was only 9 months. But her crises were so frequent that they had to give her something. And that did ease it up until she turned 5. Her crisis became less until she came 5. And then they started to change. where instead of just pains in the joint, it would be swelling of her stomach. She would have clots in her eyes, or it would be pain in her back and her thighs. She's severely allergic to mosquitoes. A mosquito bite can send her into a crisis. Just it being too hot, too cold can send her into a crisis. Um, as the years pass, she's had to have TCD, transcranial Doppler exams to find out if she's a stroke victim or she has any predispositions to having strokes, which is one of the symptoms of having sickle cell anemia. We have to get regular doctor's visits every 3 months to have blood work done to track her hemoglobin, her white blood count levels, as well as reticular counts, everything. Everything has to be checked. Adjustment of medications for weight changes. And so every 3 months is blood work shot through the vein. That's the the most unpleasant part of the regular office visits. But she's a trooper. Last year, in 2018, we moved to Georgia, and her crisis just seemed to get so worse. We were being treated at Aflac Center for sickle cell anemia, and we just didn't feel like we were getting good care there. They placed the blame of some of her crisis on us, as if we were not, like we were babying her. That's basically the word. With her stomach being swollen, they did exploratory surgeries to find out if there's anything in her stomach. There was nothing in there. She kept having acute chest pneumonia every time we went to the hospital. We would go in without pneumonia. We would end up with pneumonia, which prolonged our stay. And it was just not a pleasant experience for her or for us. There were some upsides to being treated in Georgia, where they had urgent care open for her age, where we didn't have to go to the hospital unless she needed a transfusion. So that was like the best part of being in Georgia. So my husband was like, she's not getting anywhere. We were in the hospital over 100 days. We were in the hospital between 2018 to 2019. So in the summer,
days.
over 100 days, we were in the hospital, because they gave beads for how many days you're in the hospital. So we ended up with over 100 beads that year. So my husband was like, let's go back to Florida. We called up Dr. Balles's office at Joe DiMaggio, and she was like, come on back. When we showed her the medical records for the time that she was in Georgia, she referred us to Alex's place with Dr. Zegan, Dr. Pilar's office. And they actually said that she's a candidate for bone marrow transplant because her crises are getting to an extent that it's life-threatening for her. We did go through the bone marrow transplant process, and I was her donor, and the transplant did not take. So right now, as we speak, we're back to square one. The transplant was in January. We got out of the hospital in April. She had some complications with graft versus host disease, as well as a bleeding ulcer. So she had to have surgery. She was put on a ventilator twice. We spent a lot of time in ICU. And so yeah, the transplant did not work. So we're trying to get her back to normal, to her normal, and then decide what we're gonna do after that. She, throughout the process of being in the hospital, she had what they call selective muteness. She wouldn't speak, only to say she needs to use the bathroom or she was in pain. I think those 3 to 4 months were the hardest 4 months of our lives. We were going through transitions at home with her being in the hospital too. It was, it definitely took the staff of the bone marrow transplant team to keep my family going. They definitely understood that, you know, my anger was not towards them. It was not them personally. It was towards the situation of, you know, I'm here to cure my daughter, but she's not. And there's nothing I can do about it. And I'm a control freak. So this being out of my control was really, it was really hard for us to deal with that. She had to go through chemo. She lost all her hair. I mean, it's growing bad now. She lost all her hair. She didn't eat. She didn't eat for a good 2 months. She didn't eat anything. She couldn't eat anything. There were times in the ICU where, you know, after the second time she was on the ventilator, they said they wanted to put her back a third time, and I had to say no. And they were like, you know, her lungs could collapse. And I was just like, you're just not putting her back on it because she's going to end up being here longer. So I was up most nights with her, that night in particular, because they're like, if it happens, you know, you only have 3 minutes to get air into her and stuff. So I was up, and here she is right now. So there's so many things that happened while we were in the hospital going through this process of the ICU team. Their job seemed to be to keep her alive, but not necessarily to save her transplant. I didn't feel like it wasn't their focus. Well, my focus is I want their focuses to align. I want them to have the same goals on both sides, save the transplant and save her. And it, whatever medications they gave to combat the graft versus host as well as the ulcer just did not save our transplant. We are still in contact with their office, and many of the nurses are still a part of our lives. We've gone through therapy. She still goes to therapy, trying to deal with, you know, that whole time and her feelings and getting herself back to normal, whatever that means for her.
Well, you know, wow. And
It's a
my
lot.
audience,
It's a lot.
listen, my audience is going crazy with these hearts going up for you and Grace. I can understand that. May I ask, when you are or in the middle of this crisis with your baby, and you have individuals that appear to just not understand that this is very obviously very personal and very painful, do you ever have to just say to them, you know, is that, wait a minute, you know, this is to us,
Right.
our baby, and much more serious to us. And I feel like a little more matter of fact. Have you ever had to, as a mom, have you ever had to go there?
Oh yeah, I've gone there several times while being there, and Dr. Pilar can attest to that. I am very vocal about the care of my child. I'm very vocal about the care of my entire family, and her especially being in that situation where she's my child. You, at one point I had to say, you know, you go home to your child every day. Every night you get to go home, you come, and this is like, okay, what can I do today to save Grace? And I'm thinking like, okay, what can you do today to save Grace? Because whatever you're doing don't seem to be working, because we're still here. She's still bleeding. She's still throwing up blood. She's still pooping green, and, you know, all these different things. And and when they look at me and tell me, oh, you know, I really care about your daughter, I'm doing everything I can. But then I turn around the next day and she either has a sore in her head, or I have to be watching you because the people who you send in to help take care of her. They don't really know what they're doing, or she's not supposed to be drinking, but they're giving her things to drink, or you're not really sure what you're doing. So I'm in the hospital while I'm in school, but I'm not sleeping because I have to be watching you take care of her. So there are plenty of times I'm like, you need to get out. You need to call someone else. You need to call or I'll be texting my doctor on Dr. Z on the phone, and I'm like, they're trying to do this to her and they're not explaining to me why, or this is happening and I need it to stop and they're not listening to me, or I need them to get out and leave me alone and leave her alone, or they need to all get on the same page, because it'll have one shift where one doctor is going to try this procedure or this process, and the next shift they're doing something else. It's one baby, it's one body. And I'm watching her all day. And I said to Dr. Kula, like, I feel like sometimes people go into medicine, yes, to save, but they have this godlike complex. Like, because I didn't go to school for 12, 13 years to be a doctor, I don't know, but I know her. So the idea is that you're supposed to work with me to make her better, because I know her better than you. So plenty of times I've had to put my foot down and like, you may think you understand, but you really don't. You have no idea what I'm feeling. Hi, Ebony.
How you doing, Ebony? Well, I wanted to ask that question because it's imperative that families and parents understand many times that when we take our babies, or even if our adults, to the hospital, the emergency rooms, etc., is that it's critical that they are present, and not just put all of the trust in those individuals that are supposed to be bringing the care. And that's why I asked that question, because we have a large audience here, and I know sometimes those questions come up. And give me a second, please, to welcome Ebony. Ebony, you're on mute. If you can hear me, will you unmute, please, so that we can introduce you?
Good evening. I'm sorry about the late arrival. I just came in from work. Good evening.
Good evening. Well, listen, we certainly understand, and I was praying that a crisis hadn't happened. So coming from work late is good. Let's
Yes.
have to deal with a crisis.
Stephen Smells. I'm a mom of 6. My youngest 3 are sickle cell warriors. They all 3 of them have sickle cell SS, with the older 2 being a set of identical. So it's kind of funny because I tell this story a lot, but when I was pregnant with them and growing up in the African American community, you would hear people say all the time, I have sickle cell, I have sickle cell. But because they don't look like they're going through anything, we didn't understand the severity of the disease. And then even with my husband, I remember him telling me, being ashamed to tell me in the beginning of our relationship that he had sickle cell disease. I remember he just said that, like, hey, I get sick and sometimes I have to go into the hospital. So don't think, anything of it. I didn't really learn in depth what sickle cell disease was and all of the struggles that came along with it until I had the twins. And even then, in the beginning, we just did, random visits to the doctor. And then the twins had their first sickle cell crisis, I believe, at 6 to 7 months of age. And then from there, we would spend hospitalizations every month or every other month. And it was a little harder for me because I didn't have anyone to turn to. I was like, okay, everybody's giving me resources for the twins, but what about my mental health? Because at that moment, my entire life had to stop to make sure that they had adequate medical attention. I had to become an advocate. I was very shy, very quiet as far as speaking about it. And then one day, the older twin went into the hospital and he had a crisis that ended up getting a very bad IV infiltration that caused like a crater in his right hand. And I remember the doctor saying to me, why didn't you speak up? You knew something was wrong. And from that moment on, I knew that they needed me to be their advocate. But then you hear all the time for the caretaker, like, you're so strong, or how do you deal with this? And like, there's no resources for us. There's none. There's none that takes care of me as the caregiver. None. When I'm spending back-to-back visits and my job is not understanding because sickle cell isn't a disease that everybody knows of, I'm sitting here educating my employer. Like, perfect example, I had FMLA I have FMLA now, but I worked for the government in the beginning with my FMLA. My bosses thought that the sickle cell, my FMLA only covered pain. They didn't understand that my children can go into organ failure. They didn't understand that my children require constant blood transfusions. They didn't understand that they need TCT scans. They didn't understand any of this. I'm educating employers. I'm educating people in my community. I'm educating other parents whose children also have sickle cell disease. Because you even hear people, it's so funny because you hear people even say that, I've heard a mom, I'm sorry if you hear the twins, they just came in. A mom told me one day, she said, oh, my son didn't get sickle cell disease from me. And I'm like, well, what do you mean? Oh, he got that from his daddy's side. But it takes both parents. And that shows me right then and there is a lack of knowledge. So it's very hard. It's very hard. It takes one moment.
You know, as you share that, Ebony, and also Lenreya, when it comes to educating the masses and educating our family, educating our bosses, if I could use that word, it has to be difficult, obviously. It has to be frustrating, obviously. And you've shared just recently, just momentarily actually, that there is no support even in the financial realm. What would you do? Well, let me rephrase my question. With the politicians in your areas, I know that you may live in different areas, but with those politicians in your areas, are there political advocates that are trying to assist with bringing more light to sickle cell? Are they trying to garner assistance, both medically and financially, to your knowledge, that will help parents who themselves may have sickle cell and their children?
No, there's a nonprofit in my local area called ASAP. You hear about it, but as far as someone like, okay, when I say like resources for the caregiver, so like I can explain a little bit better. It's more of their first hospitalization. I still have the book. I got a book from, I'll never forget, from the nurse practitioner that basically explains sickle cell disease and what to look for. And I remember the first couple of times, every time something would go wrong with the twins, I would call for clarity because I kept saying to myself, no one taught me what to do. Like, what am I looking for? And I still have a video in my phone of this twin right here. This is Princeton. I still have a video of Princeton.
Hi, Princeton.
Yeah, Princeton, hold on, let me let him hear you. Princeton, he said, Mr. Melvin says hi. What do you say?
Hi.
How are you doing?
How are you?
Fantastic. Glad you're here.
And there weren't any resources. I was like, I like to use this term, like a sitting duck. I was so confused on what to do because the doctor tells you, but then you're pushed into this role of understanding what a retic count is, hemoglobin, fetal hemoglobin, like understanding all of these things. And I had to like really do research. And I found myself starting to write down every little thing they said to me so that I can go and Google it myself. And it sucked because no one knows Like, and even if they don't know, like, I don't know if you read my bio, like, if they're not personally impacted, they don't care. This, to think that these children see the same doctor that an oncologist, that a cancer patient sees, and they don't get the same recognition, something is up with that. That has to let you know something is wrong. And it's
Right, and that's why I'm asking you and Lenreya if there has been any assistance from your city council persons, from your congresspersons, from your senators. Has there been anyone advocating for sickle cell assistance, or does it? And yes, let me backtrack. Yes, I did read your bio. Yes, very interesting, by the way. And also, if I can get back to that specific question, and partly because of the bio, is that there has to be someone, and I mean that literally, you know, people are coming around asking for votes and that kind of thing, and hospitals and those individuals. So I guess I'm going to rephrase this question by asking those physicians and caregivers that you're working with, are any of them advocating politically for any political assistance in this arena? And either one of you feel free, or both of you could answer, and your babies can talk as well. Ms. Lenreya, I feel free at any time. When Grace is ready to share, feel free at any time, let her share.
I'm also a member of ASAP, Ebony. I actually met Jessica through at Holt's Children's, and she invited me to ASAP. That's how I got involved with ASAP, Ebony.
It's so funny. I don't know if I'm missing them, but Dr. Alvarez, I don't know if you know who she is.
Right.
She even tells me, and I'm like, no one. I've never, like, no one has reached out, like, really having, and like some days, and you probably can relate to this, like, it was times like I couldn't even speak to my family about any of this because they just didn't understand. And it was like, it's like, oh, the twins are back in the hospital again. Oh, okay.
Right.
Like,
eventually you just stop telling people when they're in the hospital, because it's like they're like, okay, but they don't look, they're not bald, they're not, you know, losing their hair, they're not hooked up, you know. I personally, my sister, I sent Grace there once and she was like, okay, I'm gonna take her to the pool. And I was like, you know, you need to give her some Tylenol before you take her to the pool, because, you know, to prevent, you know, a fever. And she was like, oh, she'll be fine. And I was like, what? You don't understand. You don't understand.
It's so scary. Okay, so I have 3 healthy children, and this is when I knew that I needed to sit my kids down. My daughter got sick. She had like a cold. This was when the twins like were 2, and she said she had a fever. And her exact words were, I said, okay, you have a fever. I'm going to give you some medication. And she said to me, but why don't I go to the hospital?
Yeah, definitely.
And she realized, like I'll give you, like, I'm going to move him a little bit so you can see me sleeping right now. But this is Amir. This is my newborn that I just had. He also has sickle cell SS. He's sleeping. But it's funny because I hear all the time, like, they don't look
sick. And because they don't look sick, it's hard to advocate for them because they don't look sick. When you bring up sickle cell to anyone, they don't know what it is. I've been on job interviews where I had to bring printouts, because I'm gonna let you know up front, if my child has a crisis, I'm not coming in. If I can't work from home, I can't do this job because I'm gonna have to go to the hospital. I'm gonna have to work from the hospital, something. So I always explaining what sickle cell is, how it affects her. So asking for help, even through Social Security, we've been denied every time because it's not cancer. They don't think that it affects quality of life enough that she needs assistance.
Are you
Though
serious?
you've had to have been in the hospital over consecutive 12 months, maybe 10 or 12 times, you have you have to show that kind of proof. In my head, I'm like, okay, the doctor's note says she has this, but I have to still back that up by sending all this information, and it just doesn't, they don't care. You can't, the only advocates we've had is through her doctor. At Ebony, you weren't here, but we go to Joe DiMaggio in Hollywood, and that's where Dr. Ballestas and their staff, if we need anything, that's where we go. That's who's our advocate. And now Dr. Pilar and Dr. Ziga, they are the advocates because they understand, because they've seen it. Other people have no clue how sickle cell affects the child and how it affects the entire family. It's not a one person disease, it's an entire family, because we all have to make sure that the circumstances for both of them are such that they don't get sick. Like, we're always on, I tell people, I've been in quarantine for 8 years. We have to be careful of crowds. We have to be careful of being too hot, being too cold, staying away from people who are sick. We've had to pay for daycare when she only goes 2 days a week, because she goes Monday and by Tuesday they have a cold and you have to keep them home because you don't want it to end up into a crisis that they have to go to the hospital. There's no leeway when you speak to the dentist, the daycare, and like, okay, if she comes 3 days, I'll pay the full week. But if she only comes for 2 days and we have a doctor's note, give us a break. No, there's no financial assistance for that. There's no financial assistance.
It's not, there are, as much as ASAP does try, it's just,
right.
It's okay. I'll give you, my husband is an adult sickler.
Right.
And my husband, I'll say, so, like, it's a mental health situation there as well. Like, there aren't any mental health services for them. And I don't know, how old are your warriors?
We actually have a 16, an 8, and a 3.
Okay, so you're with me. So you understand exactly what I'm saying. So there's no mental health services. As they get older, they become, and my husband, I notice he gets so angry. And when he's in crisis, he's like, you don't understand, you'll never understand my pain. And I'm like, I birthed 6 kids. Maybe I don't understand exactly what you're going through, but like, give me a chance to understand. Even with the twins, it's hard because like about 2-3 weeks ago, we were in here. The younger twin, he was running and playing. He went outside. He had fun. He was hydrated, laughing, joking. He literally went out, and next thing I heard him crying. I'm like, wait, did he fall? So I jump up. He didn't fall. Just like in a matter of like 2 minutes, he was screaming. He can't move. He can't walk. And I'm like, everything stops. But then my thing is, when everything stops, like, what am I to do?
You can't schedule a crisis, Mr. Lars. You can't schedule a crisis. You can't. If we could schedule it, it would never happen. I've seen her go from just laying on the bed and watching TV to crying out in pain. You don't know when it's gonna come. And it's hard to have people be sympathetic or even empathetic towards it because they've never really heard about it. There's no movement. I've seen them sickle cell days suddenly become other days. On top, it's supposed to be sickle cell awareness month in September. They have so many other days that block out sickle cell month that the movement has become so small. Like, it is so hard to, they used to have marches and, no, not marches, like walks, like, you know how breast cancer walk. I haven't heard of that in years, in 3 or 4 years here in West Palm Beach area. And there's a sickle cell chapter here. There's supposed to be people that help us fill out the Social Security forms to ensure that we get what we need. The only time I've ever gotten help was when we were in the hospital for the transplant, and the social worker came and she did everything. She asked me all the questions. She filled them out. She got Social Security on the phone to take the information right then and there. That's the only time. And it's still been 4 months since we applied and we have not heard anything else. And that's the other situation, the wait for a response from these agencies. And then by the time they get to your name, now they're asking for additional information. They want more blood, as I would call it, from you. And then if you are making 2 cents more, it's like, okay, you don't qualify anymore. So it's like you want what's best for your kids, but if you have a 2 adult working family, there's no assistance. There's no assistance at all because you're over the income guidelines for everything.
You're right.
Which is by design, by the way.
It's definitely by design.
And you're right. She's definitely right because I remember having to tell Social Security, like, what am I going to do when I can't work? There are times I have to go weeks without working, where I'm having 3-4 doctor's visits within a 2-week span. Like, I can't come to work. Like, what am I going to do? Or like I said, the twins were coming in back to back. It's hard to explain that to Social Security because, like you said, they want a certain amount of hospitalizations. I got lucky, like you said, at Holtz. They advocated for me. The social worker went in, wrote a letter like, hey, this is the child's condition. But if I don't have that social worker or that doctor there, like pushing and standing over someone to make sure it gets done, it's not done. It's like thrown away, like, okay, denied. You don't qualify. But then
ladies, may I make a suggestion? Put your politicians to work. You have city council persons, and I know you're laughing, but I call the local TV stations. Every TV station has a health reporter and that kind of thing. It goes back, and I'm old school. It really goes back to the noisy wagon gets the attention, and you see behind me Edmund Pettus Bridge, and it is there for a reason. It's there because we have to, as John Lewis put it, start good trouble. And many times you just have to call this situation out via TV stations, via those politicians that's sitting back, and the only time you can hear from them when they want to vote and things of that nature, because obviously this is a major crisis here. And especially people of color, as both of you are sharing, we've all heard about sickle cell. We've all heard about the devastation that it causes. I had the mispleasure of having a personal friend of ours. As a matter of fact, his name was Stephen, recently passed away about a year ago. They were twins, Stephen and Jennifer. Jennifer is still with us, and I'll be the first to admit is that as it was being explained to my spouse and I about the crisis and that type thing with Stephen and Jennifer, of course we were empathetic and sympathetic, but we still really didn't process the complexity of it. So I hear you very loud, and that's why I appreciate Dr. Pillai having us contact one another, because it's going to take persons like Dr. Pillai that have the medical expertise, that is not afraid to challenge systems. And what systems do, as we well know, is what both of you have just finished explaining, is they set parameters whereby they won't have to be responsible for assisting. So it's just another situation. Yeah. But listen, let me, as I said, I don't want to do the talking here. I see Grace is standing. Miss Lenreya, would Grace just like to kind of share a little bit with us about just her situation or things she wish would improve?
Do you want to say anything about your sickle cell? Anything?
Or Miss Ebony, any of your babies as well?
It's funny, the twins don't. So the twins have ports, but they've had ports since they were like 2. The twins still don't understand what's going on. They understand that my body hurts, things like that, but they don't understand like why it's happening.
Mm-hmm. Okay.
And I don't know how to explain it because I'm still trying to teach it, like explain to my 14-year-old what's going on. So with the twins and the baby.
Right. Okay. Well, listen.
Grace
Go ahead.
rarely speaks about hers.
Uh-huh.
She's always like, what do I say? I have it. There's kids are so resilient throughout this entire process of the transplant. She has been so much stronger than I was. Like she would be there and she would have all these tubes in. She can't move. She's not crying, but I'm crying. She's one of the strong sickle cell kids are the strongest kids. One, because they don't know if there's a cure and they don't know when it's gonna end or when it's gonna come. And she weathered through it all. She asked when is it gonna be over a few times, and then she did stop speaking, but she hang in there. She didn't give up. She didn't give up.
Wow, that's very admirable, Grace. Very admirable. You know, what you are sharing with me, Lenreya, having been, I'm an old guy now, but having been one of those alleged tough guy football stars and all of that, you know, Grace is the tough guy.
Yes,
Because
she is.
what we were doing cannot even compare.
Yeah.
Wow. And for the things that you and Ebony are sharing and the pain that these babies are faced with and the dilemmas, and you've already talked about the crises and that kind of thing. I mean, there really is no explanation. You know, people try to explain things away. I mean, those of us that don't specifically deal with this situation try to explain things away, but there is no way to explain this away. And I'm going to say,
There's no
I'm going to
there's no
continue
way
to
to
go ahead. Go ahead.
there's no way to explain it away or pray it away.
Right.
I've received a lot of those. Just
Right.
pray and it'll go away, or just ignore it and it'll go away.
Yeah.
I've had,
You know, and it's
Loretta,
been
I'm sorry to cut you off. You know why I started laughing? I have had people tell me, don't listen to those doctors. They don't know what they're talking about. And you're like, wait, this is a condition that they're born with. Like, if I don't do something about this, my child could possibly, or my children can possibly have this disease for the rest of their lives.
and they
Like,
can
and
die.
I want to say to you, Lenreya, like you are so strong because it's so selfless. And I say that because Kristen and Percy, the twins, were recommended for bone marrow. And I remember telling Dr. Ziga, he's talking to me, and the only thing came to my mind was, could they die from this? And I remember him telling me it's a possibility, but the percentage is low. And then I told my husband in the car crying, I was like, I'm like, well, why would I make something that like I don't want to play with their lives. I would like rather them live with this because I'm scared. And even now I'm still scared. And the twins were referred over for transplant right before COVID hit. So because of COVID, that caused the delay.
Right.
But I still think about like, okay, things are getting back to normal. Dr. Ziga's going to start calling soon. Like, what am I doing today? Because I'm nervous. And he knows I'm nervous.
Listen,
Wow.
I would tell you, in all honesty, our situation is rare. We were on that floor for 4 months, since from the end of December till April. And I've seen that our situation is an anomaly. The way her body rejected the cells, well, my cells, is an anomaly. So I would say that if you found a donor that's more than 50%, give it a shot. I want Grace to be able to have kids pain-free. I want her to be able to travel, and if she want to be away for 6 months, let her be away for 6 months without having to worry about picking up medications or checking in with the doctor to make sure her blood count. I want her to be able to jump, run, dance, flip, all of these things. And the transplant gave us that hope. And we had went with me because I'm gonna tell you a story that my husband was supposed to be the donor. And when Dr. Z did his testing on his x-rays, they found a spot on his lungs.
Wow.
And so doctor, of course, you know, he was like, go to your regular doctor, you know, and I texted him, I said, we're not getting anywhere with getting this looked at. And I want her to do her transplant. And they were like, oh, you know, TB, tuberculosis, and all of these different things. So he called in a favor and got him to be seen, and he had lung cancer.
Wow.
So September of last year, he had to have lung cancer surgery. And in the end, I'm just like, we saved your life. Because if you didn't have grace and needed to get this workup done, you could have had this lung cancer for how many more years, and we don't know when, because it was slow growing.
Yes.
And we don't know how long you've had it. So in a sense, we saved your life. And
indeed you did.
Like,
Indeed you did.
Yay! When you think about it that way. So we've had a long year with my husband's recovery, and then us being in the hospital, and then moving and stuff like that. Hotel everybody. And it's been crazy. I would still say, if I knew, I would still do it again. And that's also on the table if we should do it again. We're gonna wait a while and see what happens and how she reacts. But I'll tell you that we've already been, Father's Day weekend, we were in the hospital with a crisis. So we were there from Saturday to Wednesday. So now that she's back to her own hemoglobin and her own cells, it is just as
if she had.
Right. It's just as, it's the same. Nothing has changed with her sickle cell. We were hoping that after the transplant, it would either downgrade or change a little bit. It's still aggressive. So it's because at first we were like, oh, we won't do it again. We're not going to do it again. But it's a possibility that if we are elected, we will do it again.
You know, as you share that, hopefully if we can stop playing politics long enough and allow the STEM research to go forward, yes, and people that use stem cells, et cetera, maybe that'll help curtail this. Because when you and excuse me, Ebony were talking about they treat it like cancer, et cetera. I'm a acute promyelocytic leukemia survivor of 30 years, and I can hear you very loudly because the symptoms are nothing like what the two of you have described. I mean, I can speak to that personally. I was given no chance to survive. I had no bone marrow transplant, anything. And when people say to you about praying and all of that, I quickly tell them, even now, is that the Bible simply says prayer without works is dead. However, even though my chemo didn't work, I was in and out of remission for 2 years, you know, a miracle happened. So I like to tell people, you know, to stop insulting people by telling them all you have to do is pray, because that's just not the truth.
Right.
You know, sure, people believe in prayer, and I can attest to that. And I can't say why I survived. I can't give them any answer other than a miracle, because the bone marrow transplants I never got. They gave me no chance to survive, etc. But what I do tell them, and I would emphasize even further, from what you and Ebony is sharing, and you're already sharing that your husband had the lung cancer, you know, it's asinine to even make a statement like that, because your own husband can tell you that the pain is, there's no even, it's not even a discussion.
Not even a discussion.
From what the two of you have described about the pain and the discomfort of sickle cell and someone having cancer, it's like day and night.
Right.
Is it serious? Of course.
Yes.
Can it take your life? Of course. But you don't experience the kind of agony that these
Wow.
babies are going through. So my hat is certainly off to the both of you. And again, I'm telling you, I am sharing. I know, and yes, and let me say this again without being sarcastic. As I was looking at the bio and that kind of thing, I kept wondering, okay, so where are the politicians in all of this? You know, there needs to be information relative on the local news stations with our education reporters that do the health reporting and that type thing to bring light, because I know you know better than I, there are other parents out there that are wishing for more advocacy. I know you mentioned, I think, what's this called? SAS, AS,
ASA.
okay, SAP, etc. But we're going to have to see some way to get these lobbyists out there. The reason I say we, as I said, Dr. Pillai was sharing with me what she's trying to do with this whole sickle cell movement. In Atlanta, Georgia, there is a friend of mine who's a former NFL player by the name of Billy White Shoes Johnson. He's trying to recruit some people as well so that we can bring more light to this and bring more light to the process and actually get legislation passed whereby you don't have to go through all of the red tape and not get the assistance that you need and being told that your income does not allow. I mean, that's just insane. So I wanted to take just this few moments to share this with both of you and to thank you so very much for being here. And also want to let both of you know that this is an open platform that I'm offering to both of you at any time. But please feel free anytime, any connections that I can share with you. I know one or two people, ladies. I know one or two people. You know, some of them are very well known, etc. And we want to get them involved with what's going on. So I certainly want to take this time to share with both of you that it's been a blessing having you. And if you have some closing remarks, please feel free to share them at this time.
I just want people more awareness to sickle cell and people to take it serious. I want, like I told you in my bio, I want our warriors to stop being looked at as drug seekers. I hate that I have to go in and fight for my child to get pain medicine from a resident that is not knowledgeable about the disease, that they're going by what they've read in the book, when every sickle cell patient is not the same and every crisis is not the same. And just because a pain medication works for one child doesn't mean it's going to work for the other child. I don't want to fight and scream for my child to get the services that they need. I've been blessed that they have an amazing hematology oncology team, but it's very hard. And I really want someone to bring awareness to the mental health of the sickle cell warrior and their caregivers, because it takes a toll on you. It really does.
For me, after going through this process, I've come to believe that the medical system is run by men. I'm saying that because in terms of the rooms on the bone marrow transplant, when it's a children's hospital, normally a parent has to be there. Well, normally a parent would be there with their child overnight. The accommodations on our floor, on the bone marrow floor, were just not conducive to a 4-month stay. My nurses had to shimmy in between the door because the cot that they have you sleeping on is right by the door. So I'm thinking the design team may not have been a mom or had anyone who's been ill that needed to be in the hospital. And Dr. Pilar has heard me complain about that several times, because I hate if there's an emergency, they have to go through me to get to her. Doesn't make sense, right? Because the door, when you come in, I'm right there. So it doesn't make sense. But in terms of sickle cell as a whole, it's definitely unfortunate that I'm in West Palm and I do have to drive to Hollywood or Miami to get good care for sickle cell. My bonus daughter, who's 16, she has sickle cell with her mom. And when I tell her about the treatment that we get at Joe DiMaggio, it's not like where she goes. But time doesn't allow for her mom to take her the same place that we go. And not every hospital can treat a sickler. Not every hospital has a pediatric emergency department. So you have to decide okay, are you going to drive an hour to your hospital because you can't take her down the street? Because all they're going to do is tell you that they can't help you, that you have to take her to a children's hospital or, you know, make that drive. The key of the issue that I have is that it's not serious enough for the politicians to take a look at it. When I love football, when I watch NFL, I see everyone has a cancer sign on their cleats. They have different foundations, but you don't see sickle cell on anyone's shoe. You don't see anyone driving around with a sickle cell bumper sticker on their
Let's make that
cars.
challenge.
You don't see any of those things.
Let's make that challenge. Let's make that challenge. Please continue.
As caregivers, like she said, she has a whole family and she works. Caregivers for sicklers, because it's not as serious, we don't have the luxury to relax and to do the advocacy that we would want to, because there's nothing to supplement any income that we have, because Social Security does not think it's a big deal. And there's no, even when I was working and I looked at the critical care that they offer for insurance, sickle cell is not on there. You have everything else, every cancer that you can think of, everything but sickle. When I call them to say, okay, I want to buy this for if something happens to her and she has to be in the hospital, that they help cover the hospital cost, nothing. Sickle cell is not covered. Sickle cell is just not taken seriously. And we have to rely on our doctors to be our advocate, because they can get in front of those audiences. They can get in, I follow Sharmika Higgins on Instagram. She has been to the White House. She has spoken to President Obama. She has been there trying to get this movement forward for sickle cell, but she is a warrior herself. We have had Jewel, and she passed away about a year and a half ago from sickle cell after, for the first time, moving out on her own in 20-something years. She finally moved out, and 6 months later, she passed away from a crisis. So we do have people who have the time, who are trying to push that movement, but because we don't have any assistance or any support from, we can't leave our jobs to do it.
You know,
We
it's
can't.
funny.
Understood, ladies.
It's funny what you said about healthcare, because it made me think about, I remember putting the twins on life insurance, like my whole house. And it's part of the reason why I keep my job is because I need life insurance for them, just in case something happens. And that's the only way that I can get it. I got denied for life insurance for a 1-year-old because of their prescription drug history. Imagine how I felt thinking, if something was to happen to my child or my children, how am I going to bury them? Because they were denied for health insurance.
And Social Security only gives you a couple $100 for a funeral.
$250.
And I felt like crap. I'm like, what am I going to do? Like, I have a husband that doesn't qualify for life insurance because of his disease. Like,
wow.
What am I going to do if they, God forbid, if they pass because of this pre-existing condition that they had no control over?
Right.
This is
and let's not think about, I feel like if you have a child with a life disease or any disease at all, mental health services should be free for the entire family, because as a caregiver, the stress that we feel takes a mental toll. We don't get a break. We are always on the go. We're always ready to go. You always have a backpack in case this is going to be a crisis weekend or a crisis day. Like, I found that my daughter's therapists have been there for me throughout this entire process, because I don't have insurance, so I don't have access to a therapist. Mental health is not only for the athletes. Mental health is not only for, for people who is going through their own thing. I need my mental health to be well in order to take care of my family. We don't have that. We don't have that kind of support. I've seen Dr. Ziga drive up here to take a look at her because she was not feeling well. I've seen where we can't, He's an amazing,
He is,
like
him and Dr.
Edward
Alvarez is
Ziga.
amazing.
If
I'm
I don't
sorry,
believe anyone has been God sent, I
Who are
I'm
believe
they?
sorry,
Edward
guys. This is my
Ziga.
husband.
Who
Babe,
are-
say hi. He's
How you
over
doing,
there.
man? You okay?
Hello.
Good to see you.
That's my other
Edward
warrior.
Ziga and Dr. Pill, I believe that they are God sent. This Dr. Ziga does not treat Grace. He treats my entire family.
Wow.
Everything is family oriented. If she has to come for an appointment, how are you gonna get to the appointment? What time do you need your appointment to be? Are you gonna drive or are you gonna take the shuttle? How are you gonna do it? Who's gonna watch the baby? What does she want? Does she want some oranges? She'll text him, I want to see you, Dr. Ziga, and he's here from Miami on a Saturday afternoon when he's on call. He makes that drive for 10 minutes to come and
Wow.
see her.
Wow.
You don't have doctors who care about an entire family.
No, you don't.
This team treats your entire family.
They do.
So even though my transplant was not successful, I still have faith in them.
Yeah.
Because they treat us all.
Wow.
And I agree with you. I agree
That's a
with you. Like
fantastic testimony.
I agree
Go
with
ahead.
you. I found myself crying too with Dr. Ziegler and Dr. Alvarez because they are amazing.
Wow, that's fantastic.
When I
And
tell
also-
people about him,
Also,
people
Ebony,
they're like, you have
free
your doctor's cell phone?
to tell your husband he's
I say,
welcome
yeah.
to join us. I'm sorry.
He's trying to deal with the kids, so he keeps running back and forth with he just grabbed the baby. And
Okay.
he's dealing with the twins. Yeah, he's trying
Okay.
to help out.
Okay, I'm sorry. Lenreya, you were speaking.
No, I was just saying when I tell people about him that we have his cell phone number to just call them, text them whenever. They're like, really? A doctor gave you their number? They're not afraid? I'm like, nope. I text him about an issue while I was in the ICU at 2 a.m. He was at the hospital at 2:30
Wow.
in the morning.
Wow.
He was like, whatever time, whatever, no question is too small.
He's
no
an unsung
question is
hero.
too dumb. Yes.
He is an unsung
He is.
hero.
Days when I wanted to give up, where I was like, I'm just gonna take her and go home. He's
Yeah.
like, just no. I was like, I can't do it anymore. I can't keep putting her through this every day with these people. And that was the ICU team because I don't like them. And he was like, let me talk to them. Let me talk to them. Don't cuss them today. He was like, not today. Not today.
You were just sleep deprived. You know, when you were in there, you don't get no sleep.
Let me tell you, man. Sleep deprived,
Listen.
no good food because not enough good food to eat, and being afraid to, Ebony, I was afraid to leave her.
Me too. I don't
Because I
leave them.
felt like if I left her in the ICU, they were gonna intubate her. I could not leave her. So if I went to the bathroom, if I had to leave to go shower, I had to have someone there. So the therapist or Dr. Ziegler would have to be there. Someone from the bone marrow team would have to be there for me to go. I'm not leaving her with you because I don't trust you guys. You guys don't consult me when you're gonna do anything. So I can't trust you. So I'm awake most of the time while I was there. When I switched out with my husband, he was like, I don't know how you do this. I'm like, because I don't have a choice. Caregivers for sicklers don't have a choice. We can't run away because can't run away. We don't have a choice because we know that the cure is not around the corner. Not with cancer patients. Not that every cancer patient is cured or survives, but there's no, okay, I'm diagnosed today and 3 months later,
All right, fellas.
I'm gonna be going through something that's gonna get me cured. You know, it's a
Yes.
lifelong situation that
Yes.
we have to learn and teach them to stay hydrated. So it's so much involved that we could be here all night.
So that's what I'm sharing with you tonight, is that I'm willing to do anything that I can to help bring more light to this. And that's why I'm sharing with you a doctor that you guys are speaking so dearly and so lovingly of. Ask them if they will contact their Congress people or if they will contact people like Al Sharpton and even President Obama. I mean, he's out of office. That doesn't mean that he can't assist. I mean, he knows
Right.
everybody there. And last thing I'll say, I'm not just saying it to you as a video caster. I am saying that I am, if you will, if you don't mind, Lenreya or Ebony, if you'll send me some contact information for the doctor that you're discussing. And Lenreya mentioned the young lady that has spoken to President Obama. If you send me some information, I will reach out and make contact to keep pushing this. And that's why I share with you. You said a mouthful, Lenreya, when you mentioned the professional athletes having different organizations and different kind of things on their shoes. I happen to know one or two active professional athletes, professional agents, etc. And we certainly can touch bases with them as well to see if we can't get this to be part of the narrative. There are some ears, I'm sure, that will listen, but I would love to have you as parents be able to speak with them, people of color. We are remiss in our obligation of addressing illnesses that specifically affect us. I mean, I'm going to just put that out there. And there should be all of these Black politicians. Yes, I'm saying it on the Nobody Asked Me Guy show. All of these Black politicians should be advocates. It shouldn't take parents like you to have to say, hey, we need some more help. We need people to bring a voice. We need this to be addressed appropriately. Our babies are in dire pain. They're hurting. Unfortunately, some of them are passing away, etc. So this is much bigger, as you're sharing, Ebony, as you're sharing, Lenreya. This is much bigger than individuals that want to be important. So I'm pledging to both of you and our listeners and anyone else that I'm going to continue to be on this battlefield with you, along with Dr. Pillai, and I would love for us to keep this going. So ladies, we have 2 minutes. Who wants to go?
Thank you for inviting us on your show. Definitely, this is my first time. I don't have a podcast or anything like that. I don't know. I've been just so busy with this. I don't know how to do anything like that. So thank you. Definitely thank you for this opportunity to speak about our journey.
You're more than welcome. So ladies, have a great, fantastic night. This has been the Nobody Asked Me Guy show. I'm your host, Melvin Casey Lars, and we need to address sickle cell. And I see you, look at this beautiful baby, Miss Grace, waving goodbye to us. And we need to take this baby in our hearts and address her. Miss Ebony was showing us her beautiful babies. And I have one last thing, Miss Lenreya, when you say men, they are males. And I'm going to leave it right there. They are males, real men, and men address the needs of, and dare I say, without being chauvinistic, of our women. That's what men do. Now, males, that's another animal, and I'll leave it there.